We're here today partnering with Afrique and Olympus to magnify the issue of esophageal cancer, which many people in Uganda don't know how prevalent the disease is in Uganda.
What's important in stent placement is you want to know how far your tumor really is from the upper esophageal sphincter. That's a very, very important thing to know, because if it's really high, it impacts whether you can put a stent, what kind of stent you put, because as you can think about, it can compress the trachea, it can compress the airway and can cause stridor if you put too big of a stent, or it can be very, very uncomfortable.
It's 7 centimeters. If I do 10, there's 2 above, 1 down, so the 1 can easily get overlapped as tumor grows. So I think it would just be better to do 12, and you know you have adequate length, on free length on either side.
If someone does come with their esophagus blocked off, they can't even swallow, and so an endoscopy can be done. A tube can be put in called a stent, S-T-N-T, and after that's in, it changes the situation from at least not being able to swallow it all and having to carry a spit cup to being able to swallow liquids and soft foods. And in fact, part of the reason we're here today is because a goal of AFRAC and a goal of many places is to train more and more doctors in Uganda and other countries to do this.
So in this task, they are training the surgeon to have the ambidexterity of the hand. So you pick with your non-dominant hand, then you put it to your dominant hand. You see your speed. Even when they are examining you, they are looking at your proficiency.
Just the realization alone that esophageal cancer is one of the leading cancers in Uganda, and hardly anybody is talking about it, has a concern. Once I learned also not just about the trends in the incidences, but also the risk factors which really affect our daily lives.
So I want to thank you who traveled from wherever, Mbarara, where to come to Budondo and do this training.